Most men over 60 are doing everything they think is right. They are getting their checkups. They are taking their medications. They are trying to eat reasonably well. And prostate cancer is still rising at a rate that should alarm every single one of us. But here is what nobody is telling you. Prostate cancer does not just appear out of nowhere. It does not strike randomly. In most cases, it is fed. It is nourished. It is given exactly the environment it needs to grow, quietly, over years, inside your body. And the thing feeding it is something that is happening inside millions of men right now, today, as you watch this. It is called chronic inflammation. And it is the shocking root cause of prostate cancer that almost no doctor takes the time to explain. Today I am going to show you exactly what it is, how it works, why it is so dangerous, and most importantly, how you can starve it. Not with surgery, not with medication, with choices you can make starting today. Real, science-backed, senior-specific choices that the research is now calling some of the most powerful tools we have against prostate cancer progression. Stay with me until the very end, because the section on how to actually starve this process is where the real value is. And I promise you, by the time this video is done, you will think about food and lifestyle completely differently than you did when you pressed play. I am Dr. Ethan Whitmore, and I specialize in senior urology and prostate health. For over 2 decades, I have sat across from men who have just received a prostate cancer diagnosis, or a worrying PSA result, or a biopsy report that changed everything. And before I go any further, I want to ask you 2 quick things. Drop them in the comments right now. Where are you watching this from, and how old are you? I read every single comment, and I genuinely want to know who is in this audience because what I am about to share is especially critical for men in their 50s, 60s, and beyond. In almost every case I see, when I look at a patient's history, their diet, their weight, their lifestyle over the previous decade, the same picture emerges. A body living in a state of chronic, low-grade inflammation. Quietly, without symptoms, without warning, until it was not quiet anymore. Here is what I want you to understand before we go any deeper. Prostate cancer is not just bad luck. It is not simply genetic destiny. Science is now giving us a very clear picture of the biological environment in which prostate cancer is most likely to develop and progress. And chronic inflammation sits at the very center of that picture. This is published, peer-reviewed science from institutions like the NIH, Harvard, and leading European oncology journals. And it changes everything about how we should be thinking about prevention. So let us talk about what inflammation actually is, because most people think of it as swelling after an injury. A sprained ankle, a cut that gets red and warm. And that is inflammation, the acute kind, and it is actually good. Your immune system rushing to heal damage. That is healthy and normal. But there is another kind of inflammation, the kind that does not announce itself, the kind that has no obvious symptoms, the kind that smolders inside your body for years, releasing a slow, steady stream of chemical signals that damage cells, disrupt DNA repair, and create exactly the kind of biological environment in which cancer cells thrive. This is called chronic, low-grade inflammation, and for millions of men over 60, it is running silently in the background right now. Think of it this way. Imagine a fireplace in your home. A proper fire, well-managed, contained, serves a purpose. That is acute inflammation. Now imagine leaving a pile of embers smoldering in the corner of the room for years. No visible flame, no immediate danger you can see. But the heat is there, slowly, consistently, degrading everything around it, warping the wood, weakening the structure, creating conditions where something much worse can take hold. That is chronic inflammation, and your prostate is in that room. Now here is where the science gets important. Multiple studies, including large-scale research published in European Urology and linked through the NIH's own research databases, have established a clear connection between pro-inflammatory biological states and both the development and progression of prostate cancer. What the researchers found is not just a correlation. They found a mechanism. Chronic inflammation damages prostate cells directly. It creates what scientists call a pro-tumorigenic microenvironment, meaning the tissue around the prostate becomes more hospitable to abnormal cell growth. Inflammatory chemicals called cytokines, the same ones released during chronic low-grade inflammation, have been shown to promote the kind of DNA mutations that initiate cancer. And once cancer cells are present, That same inflammatory environment acts as fertilizer, signaling those cells to grow, divide, and resist the body's normal defenses. Let me put that in the simplest possible terms. Chronic inflammation does not just increase the risk of prostate cancer developing, it actively helps it grow once it is there. It is both the spark and the fuel. So what is creating this chronic inflammation in the first place? Because this is where it gets very actionable, very quickly. The first major driver is obesity and excess body fat, particularly the fat that accumulates around the abdomen. This is not simply a cosmetic issue. Visceral fat, the fat stored around your internal organs, is metabolically active. It releases a constant stream of inflammatory chemicals, including interleukin-6, tumor necrosis factor alpha, and C-reactive protein. Research published in NIH-linked reviews has consistently shown that obese men have significantly higher levels of systemic inflammation than men at a healthy weight, and that this inflammation directly correlates with both higher prostate cancer incidence and more aggressive disease progression. A 2021 meta-analysis found that obese men diagnosed with prostate cancer had substantially higher odds of developing the aggressive, high-grade form of the disease compared to men at a healthy weight. The second major driver is diet. Specifically, the ultra-processed, high-sugar, red meat and processed meat-heavy diet that has become the default for so many men in the Western world. Every time you eat a highly processed food, a sugary drink, a processed deli meat, a fast food meal, your body registers it as a low-level inflammatory event. Once in a while, your body handles it, but consistently, meal after meal, day after day, decade after decade, you are stoking that smoldering fire. Research published in journals including the American Journal of Clinical Nutrition has shown that men whose diets score highest on inflammatory index measures have measurably higher prostate cancer risk and faster progression in men already diagnosed. The third driver is insulin resistance and hormonal disruption. When you are eating a high-sugar, high-processed carbohydrate diet over many years, your cells begin to lose sensitivity to insulin. Your body compensates by producing more and more of it. Chronically elevated insulin levels trigger inflammatory cascades throughout the body. They also disrupt testosterone metabolism in ways that have been linked to prostate cell proliferation. This is a cycle. Poor diet causes insulin resistance. Insulin resistance causes inflammation. Inflammation fuels prostate cancer risk. And because it happens slowly over years, most men have no idea it is occurring. The fourth driver is oxidative stress. Every cell in your body produces waste products during normal metabolism. Your body has antioxidant systems designed to neutralize these. But when you are eating poorly, not exercising, smoking, drinking heavily, or chronically stressed, your body's antioxidant defenses are overwhelmed. The result is oxidative stress, which directly damages DNA in prostate cells and feeds the inflammatory cycle. Now here is what I need you to sit with for a moment, because this is important. Everything I just described is modifiable. Obesity, diet, insulin resistance, oxidative stress. These are not genetic sentences. These are conditions created by lifestyle, and they can be changed by lifestyle. A 2025 systematic review published in European Urology Oncology, one of the most respected journals in our field, analyzed multiple large studies and found that men who adopted low-inflammatory, plant-rich dietary patterns showed significantly reduced prostate cancer progression risk compared to men on standard Western diets. Significantly. Not marginally. Significantly. This means you have more power over what happens inside your prostate than most men have ever been told. And that power is what the rest of this video is about, because now we know the root cause. Chronic inflammation, driven by excess body fat, poor diet, insulin resistance, and oxidative stress, creates the environment in which prostate cancer develops and thrives. So the strategy is clear. Starve the inflammation. Change the environment. Take away the fuel. Let us go through exactly how you do that. The first and most powerful thing you can do is shift your diet toward an anti-inflammatory, plant-rich Mediterranean-style eating pattern. This is not a fad diet. This is the most extensively studied dietary pattern in human health research. The Mediterranean diet, centered on vegetables, fruits, whole grains, legumes, olive oil, fish, and nuts, with minimal red meat and processed food, has been shown in multiple large studies to reduce systemic inflammatory markers dramatically. That 2025 European Urology systematic review I mentioned found that adherence to plant-based anti-inflammatory dietary patterns was one of the most consistent protective factors against prostate cancer progression across multiple study populations. You do not need to become a strict vegetarian. You need to shift the ratio. More plants, more color on your plate, less processed, less red, less packaged. That shift alone begins changing your inflammatory biology within weeks. The second specific food category I want you to focus on immediately is lycopene-rich foods. Lycopene is a carotenoid antioxidant found predominantly in cooked tomatoes, and the research around it and prostate cancer is among the most compelling in nutritional oncology. A large Chinese case control study found that high lycopene intake was associated with a significantly reduced risk of prostate cancer, with particularly strong effects when combined with green tea consumption. The reason cooked tomatoes are more effective than raw is that cooking breaks down cell walls and increases lycopene bioavailability dramatically. This means tomato paste, tomato sauce, and cooked tomatoes give you more lycopene per serving than a fresh tomato salad. Watermelon, pink grapefruit, and guava are also excellent lycopene sources. Aim for some form of cooked tomato product at least 4 to 5 times per week. Pasta sauce, tomato-based soups, shakshuka. Make it a regular feature of your diet, not an occasional side. The third habit is one you can start tomorrow morning with zero cost and zero effort. Green tea. 2 to 3 cups per day. Green tea contains powerful compounds called catechins, particularly EGCG, epigallocatechin gallate, which have been shown in multiple studies, including Asian population research where green tea consumption is high and prostate cancer rates are notably lower, to directly inhibit inflammatory pathways and interfere with the signaling that promotes prostate cancer cell growth. The synergistic effect of green tea and lycopene together was specifically highlighted in research as particularly beneficial. If you are a coffee drinker, you do not need to give it up entirely. But replacing 1 or 2 cups with green tea is one of the simplest swaps you can make with genuinely meaningful biological impact. The fourth category is cruciferous vegetables. Broccoli, cauliflower, Brussels sprouts, cabbage, kale. I know, these are not the most exciting foods, but the research behind them for prostate protection is extraordinary. These vegetables contain compounds called glucosinolates, which, when chewed and digested, break down into biologically active molecules, including sulforaphane and indole-3-carbinol. Sulforaphane, in particular, has been shown to directly inhibit the growth of prostate cancer cells in laboratory studies and to reduce cancer-promoting inflammation. A landmark study from the Fred Hutchinson Cancer Research Center found that men who consumed 3 or more servings of cruciferous vegetables per week had a 41% lower risk of prostate cancer compared to men who rarely ate them. 41%. That is not a small number. That is the kind of risk reduction we would be celebrating if it came from a drug. And it comes from broccoli. Eat them steamed, roasted, in soups, in stir-fries. Aim for at least 3 servings per week. More is better. The fifth habit is optimizing your omega-3 intake and actively reducing your omega-6 and processed fat consumption. Your body needs a balance between omega-3 and omega-6 fatty acids to regulate inflammation properly. The problem is that the modern Western diet is wildly skewed toward omega-6, found in vegetable oils, processed snacks, and fried foods, which promotes inflammatory signaling. Omega-3 fatty acids, found in fatty fish like salmon, sardines, and mackerel, as well as in walnuts and flaxseed, actively reduce the production of inflammatory cytokines. Multiple studies have shown that men with higher omega-3 intake have lower levels of the specific inflammatory markers associated with prostate cancer progression. The goal is simple. Eat fatty fish at least twice a week. Add a small handful of walnuts as a daily snack. Switch from vegetable oil to olive oil for cooking. And actively reduce your intake of processed meats, sausages, hot dogs, and deli meats, which have been specifically flagged by the World Health Organization as carcinogens, with direct colorectal and evidence-supported prostate cancer links. The sixth habit is managing your weight with genuine intention. I know this is the advice everyone gives and nobody wants to hear, but I need you to understand something specific here. It is not about aesthetics. It is not about a number on a scale. Visceral fat, the fat around your middle, is biologically active tissue that is producing inflammatory chemicals every single hour of every single day. Losing even 5 to 10% of body weight in men who are overweight has been shown to produce measurable reductions in C-reactive protein, interleukin-6, and other inflammatory markers within weeks. The anti-inflammatory diet shifts I just described are also the most effective approach to sustainable weight loss in men over 60. They work together. More plants, less processed food, reduced insulin levels, reduced inflammatory fat, reduced cancer risk. It is one connected system. You are not doing separate things. You are doing one thing with multiple benefits. The seventh habit is the one I cannot emphasize enough, and that requires no dietary change at all. Early and consistent prostate screening. I have just spent this entire video explaining how you can change your biological environment to make it less hospitable to prostate cancer. But no lifestyle change eliminates risk entirely, and prostate cancer caught early is extraordinarily treatable. PSA testing, prostate-specific antigen, combined with digital rectal examination, gives us the ability to detect prostate changes long before symptoms appear. According to current NIH and American Cancer Society guidelines, men over 50 should be having this conversation with their doctor regularly, and men with a family history of prostate cancer, or men of African descent, should begin that conversation at 40. If you have not had a PSA test recently, please schedule one. Not next month, this month. The dietary and lifestyle habits I described today are about changing your long-term trajectory. Screening is about making sure that if something has already begun, we catch it while our options are widest and our outcomes are best. These two things together, change the environment and monitor closely, are the complete strategy. Now let me bring everything together because I want this to be something you actually act on today, not something you found interesting and then forgot. The shocking root cause of prostate cancer is not bad luck. It is not simply genetics. It is the chronic, low-grade inflammatory environment that develops over years inside the bodies of men who are eating a pro-inflammatory diet, carrying excess weight, living with insulin resistance, and flooding their cells with oxidative stress. This environment, silently, consistently, damages prostate cells, disrupts DNA repair, and creates the biological conditions in which cancer develops and thrives. And you have significant power to change that environment, starting today. The Mediterranean-style anti-inflammatory diet is your foundation. Cooked tomatoes and lycopene-rich foods are your targeted ammunition against prostate inflammation. Green tea daily is one of the simplest, cheapest, most evidence-backed swaps you can make. Cruciferous vegetables 3 or more times a week have been shown to reduce prostate cancer risk by 41% in published research. Omega-3-rich fatty fish twice a week and eliminating processed meats reduces the cytokine load your prostate is living in. Managing your weight reduces the visceral fat that is actively producing inflammatory chemicals around your organs. And consistent PSA screening ensures that all of this protective work is backed up by real medical monitoring. None of this is complicated. None of it requires perfection. What it requires is consistency. Small choices, made consistently, over weeks and months, produce real biological changes. And those biological changes reduce real risk. If this video gave you information that your doctor has not taken the time to share with you, please hit the like button right now. It genuinely helps this channel reach more men over 60 who need this information and are not getting it anywhere else. Subscribe and hit the notification bell because every week I bring you the science-backed, senior-specific health information that should be standard in every urology practice, but often is not. Drop a comment below and tell me which of these 7 habits are you going to add first. And please, share this video with the men in your life. Prostate cancer is the second most common cancer in men worldwide. Most men have no idea they have the power to change their risk. You can give them that knowledge today simply by sharing this video. Your prostate health is not out of your hands. Take back control of it starting tonight.